end abuse in our communities. Thank you. I yield back to the gentleman.
Thank you. And Mr. Speaker, I do thank you for your indulgence. You have been liberal with the time, and I want to remind persons that while we do this on an annual basis in the month of October, we do want to make domestic violence awareness an everyday activity. Thank you, Mr. Speaker, and we yield back the balance of our time.
The gentleman yields back. Under the Speaker's announced policy of January 3rd, 2013, the Chair recognizes the gentleman from Texas, Mr. Gohmert, for 30 minutes. When's his time start when he starts speaking? Ron DeSantis coming up here next.
He was just checking out on the House review last year because he's the last person.
Okay. The gentleman is recognized.
Thank you, Mr. Speaker.
Good job, Mr. Reed.
This has been an interesting week for a number of reasons. Mr. Speaker, I'd like to call to attention a letter that was written by Chairman Darrell Issa, our friend from California, to Secretary Kathleen Sebelius at the U.S. Department of Health and Human Services this week. First paragraph, after saying, "Dear Madam Secretary," says, "The Committee on Oversight and Government Reform is investigating the insurance exchange application online at healthcare.gov, established by the Department of Health and Human Services. As part of this investigation, we're writing to request information related to voter registration data collected during the application process." On further down, the letter says, while HHS and its contractors continue to struggle with the task of processing applications for health insurance coverage, the agency uses the website to collect voter registration information. Once an applicant completes the online application for health care coverage, a dialog box appears asking, "Would you like to register to vote?" In light of the National Voter Registration Act of 1993, also known as the Motor Voter Act, which requires any agency that provides public assistance to provide individuals with an opportunity to register to vote, the Department decided to include the voter registration option on the health care application. The inclusion of this voter registration may give applicants the impression that registering to vote is somehow tied to receiving health care benefits, such as insurance subsidies. Given the well-documented flaws with the health care application process, the public lacks confidence that HHS has the ability to safeguard applicants' voter information. Documents reviewed by the committee show that applicants may submit personal information over the Internet during the application process without encryption, potentially exposing personally identifiable information to interception and abuse. Further down, it says, further, it's unclear how HHS uses the voting information it collects once a user submits this data on the website. Applicants rightly expect that only state election officials will have access to their information. Voter registration contains important personal details that are valuable to various individuals and organizations. Toward the end, Chairman Issa says, these facts raise questions as to what happens when the same individual expresses the desire to register to vote multiple times. HHS does not appear to have the capacity to differentiate between duplicates and first-time applicants. In short, it's unclear what happens to voter registration information once HHS receives it. applicants have an expectation that the federal government is not transmitting private information to third parties knowingly or unknowingly. But interesting questions raised by our friend Chairman Issa. Should also be noted that the chairman of the Subcommittee on National Security, our friend Jason Chaffetz, also signed that letter. So that certainly caused some digging in our office to find out what this was about. And then we find information about Demos, DEMOS.org. They have a report by Lisa J. Danitz called Building a Healthy Democracy, registering 68 million people to vote through health benefit exchanges. Well, that's interesting. Makes you wonder what they're up to. They're involved in this healthcare.org apparently, and their own information from demos.org says they're going to use the health benefit exchanges apparently to try to register 68 million people to vote. So while people in America, and I've talked to many who are just scared because they've got someone sick in their family, they've lost their insurance that the president promised they could keep, they're scared about the super high deductibles they've gotten, they're scared that under Obamacare they have been sentenced to go from full-time work to part-time work, which means, as I've heard from some, that gee, that means we've now had to go on public assistance because I never wanted welfare, didn't need welfare until the so-called Affordable Care Act forced us into it. So people are concerned all over America. The majority want Obamacare gone. The website's not working. And then we find out that actually the website seems to be as concerned about getting people registered to vote and getting their invaluable voter information as they are about dealing with the crisis in American lives involving their health care and their health insurance. You got people with an ulterior motive. They're apparently not just signing people up from the goodness of their hearts, because Demos makes clear in their own information, we're going to use the health benefit exchanges to register voters. Well, now, who would they be registering to vote? Because we're all in favor of people eligible to voting, although we know that the Attorney General has sued states like Texas, even though the Supreme Court has made clear that Indiana's law requiring a photo ID, the Attorney General's rules that require a photo ID to get in to see him, the Democratic National Committee requiring photo IDs to get into their convention, having to have a photo ID to get alcohol or cigarettes or basically get on a plane or get on most any conveyance in interstate commerce. You got to have a photo ID, and states like Texas have said if you can't afford it, then just fill out the oath and we'll take care of it for you. So on the one hand, we have an Attorney General and Department of Justice doing everything they possibly can, even in the face of a Supreme Court decision saying photo ID requirements are okay. They still are going after states, which I would humbly submit, Mr. Speaker, disenfranchises legitimate voters when the Attorney General of the United States takes actions to prevent states from preventing fraudulent votes. I was shocked when people called out for international observers to come watch our own election process. This is America. We don't need international observers to watch our process, so I thought. And yet, international observers watched our process of voting and were absolutely shocked that we were so cavalier about who got to vote. No identification requirements. Clearly, people were in a position to vote more than once if they wanted to. People were in a position to vote who were not U.S. citizens, because, and people could vote multiple times. I know in Iraq, I was over there right after their first election, and those people had to dip their fingers in permanent ink that they wore around for weeks until it finally wore off. But it made sure that even in Iraq, that they were protecting the integrity of their voting system further than what we're doing here. Well, this demos.org, they're going to register, they say, 68 million people to vote through health benefit exchanges. So the thing to do, it seemed to me, was to get their annual report. So, Mr. Speaker, that's what I got, the Demos Annual 2012 Report. See who these people are that are going to register voters. I'm sure they would be fair and register voters from all walks of life. Oh, and then here we see the president, Miles Rappaport, and he's being the president. He's got a nice letter from the president, board chair. So then you look up a little background. Let's see, well, who is this Miles Rappaport? And an article from KeyWiki said Miles S. Rappaport is the leftist president and CEO of New York-based think tank Demos. Goes on to say, while studying at Harvard in the late 1960s, Miles Rappaport was active in the radical Students for Democratic Society, SDS. Mr. Speaker, it seems like, having in the back of my mind, SDS evolved into something called, some of them did, Weather Underground, that Bill Ayers would know a great deal about, being that he held the first fundraiser for the man who is now our president. But the article goes on to say Harvard SDS campaigned against U.S. military involvement in Vietnam. Obviously, a lot of people did. And the presence of Reserve Officer Training Corps, ROTC, on campus. An April 7, 1969 letter to the Harvard Crimson opposing Harvard President Pussey's support for the ROTC, Miles Rappaport and fellow SDSers Naomi Shapiro, Carlin Meyer, Rick Brown wrote, quote, to conclude, President Pussey and the President Pussey, they support the U.S. military and the policies it carries out. We feel that ROTC must go because we oppose the policies of the United States and we oppose the military that perpetuates them. The lines are clearly drawn. The time to take sides is now. Ah, well, that was Miles Rappaport, the president of Demos, that's going to register 68 million people through health benefit exchanges that most of us thought were actually just going to be trying to help people get health insurance. They're going to gather their most personal information and allegedly get them registered to vote. And you can't help but wonder what people like former SDS leader Miles Rappaport want to do with people's personal identification information. So, looking on further back in the Demos Annual 2012 report, see what kind of fundraisers they've had. Well, they had a 2012 Transforming America Awards and Gala celebration. So we look down. Who are the honorary chairs? Oh, there's Bertha Lewis, the head of, well, some may remember, she was head of something called ACORN. So the former head of ACORN, right in there, honorary chairman helping Demos, that's going to register 68 million people through the health benefits exchanges. Who else we got? Oh, there's Richard Trumka, the president of the AFL-CIO. Oh, and here is our friends at Service Employees International Union, SEIU, and of course the International Union, UAW. So that gives us a little feel about what Demos is doing, but it caused a little further examination as to who is it that's gathering this very personal information that Demos wants to use to get 68 million people registered to vote through the health benefit exchanges. And there are a lot of issues questions that need to be answered. Not only how are they using the personal information of people that just wanted to protect their families or themselves with insurance, so who is it that's actually gathering this information to help Demos in their efforts? Well, there's an article here from PJ Media by David Steinberg, Draining the Swamp, Top 40 Troubling Listings from the Obamacare Navigator Assistance Security Nightmare. The article said, last week we reported that the honor system is being used to confirm the identity and certification of navigators/assisters. The Find Local Help feature on healthcare.gov refers consumers to potential predators. We have since reviewed state by state every single navigator and assister that healthcare.gov currently displays to the public via, quote, Find Local Help, unquote, that people can click on. This search revealed 2 additional dangers of the navigator-assister system. It's not just a defunct or a problematic website. There's a problem with who's doing this, who's gathering information, who is this nightmare and train wreck of a website sending people to. This says, number one, the consumer is vulnerable, but so is the taxpayer. The program is rife with organizations that have advocated for open borders, have helped illegal immigrants dodge apprehension, have attempted to give illegal immigrants access to additional taxpayer-funded resources. Such organizations are obvious risk to fraudulently register illegal immigrants for subsidized health insurance, and as such have no business being included in the government-funded Navigator-Assister program. Number 2, regulations require Navigators-Assisters to be unbiased. Unbiased in quotes. However, many organizations that were founded partly or entirely to advocate for politically left-leaning policies, including causes such as universal health care, single-payer, and Obamacare itself, are nonetheless part of the program. Many of these groups already receive government funding, which further raises the obvious conflict of interest issues. As many will be paid according to the number of consumers successfully registered for an Obamacare plan, such groups have several incentives to steer consumers away from free market plans that may be superior options. Outside of the list below, only a handful of suspicious, open borders, or politically biased organizations have been exposed nationally. But below is a list of 40 to spur the much-needed discussion. The list is divided into 3 categories. Some listings may fit more than one category, but all are listed only according to the primary concern regarding each. Number 1, open borders groups. These groups exist in part or in whole to secure the greater federal benefits for illegal immigrants. As such, all are obvious risks to fraudulently register illegals for subsidized insurance. Number two, politically biased organizations. Obamacare regulations require all registered help to be, quote, unbiased, unquote, yet these groups include leftist political advocacy as a primary part of their mission, presenting conflict of interest problems. Additionally, they have financial incentives to steer consumers away from free market plans. Three, suspicion regarding legitimacy. Of great concern, considering healthcare.gov does not guarantee the legitimacy of any listings. While some of these listings may be legitimate, healthcare.gov saw fit to approve and expose these suspicious listings to consumers with no further information to assist with their choice. A final note, these listings are certainly incomplete. Community health centers have generally been excluded from it, though the sector has generally been supportive of the push for Obamacare. If included, this list would be several times longer. Also, a part 2 of this article is forthcoming. But their Open Borders group, number one, Campesinos Sin Fronteras, Farm Workers Without Borders. This Open Borders organization has participated in countless rallies and activities advocating for the decriminalization of illegal immigration. For just one example, read Director Emma Torres' organization of a march in 2006. It quotes from that in this article and says, the 5-mile walk was marked by chanting, the waving of American and Mexican flags, and showing placards of opposing Senator Sensenbrenner's proposal to criminalize undocumented immigrants and those who help them. Emma Torres, advisor at the Institute of Mexicans Living Abroad and director of Farm Workers Without Borders, stated that a committee had recently been formed to plan the May 1st event. Around 30 people formed the committee in order to convoke a boycott of commercial goods and services and a walkout of jobs and schools. The purpose of the committee, said Torres, is for the United States to feel the weight of the contribution of immigrants because, quote, a lot of people deny the contribution that we make as legal or illegal immigrants, and they don't want to see that we have so much power in the economy, unquote. Number two, Hispanic Women's Organization of Arkansas. This group's website boasts of being an affiliate of leading radical open borders organization La Raza. The success, and it quotes, the success of HWOA, Hispanic Women's Organization of Arkansas, programs and events also lies in its affiliations with local, state, and national organizations. In 2001, HWOA was selected to participate in the Emerging Latino Communities Initiative of the National Council of La Raza. Since October 1st, 2004, HWOA has been an affiliate of NCLR, whose mission is to reduce poverty and discrimination and improve life opportunities for Hispanic Americans. Sounds nice, but they are certainly not unbiased. And again, Mr. Speaker, these are organizations that are listed at healthcare.gov, apparently, to be navigators or assisters to help people with their health care choices, but obviously these organizations seem to have other motivations. Number three is the Center for Pan-Asian Community Services. This organization has expressed its support of just about every attempt to legalize the U.S. illegal population and additionally expressed displeasure with voter ID law. They rallied against the Supreme Court decision in Shelby versus Holder, inviting members to participate in a, quote, voter suppression update teleconference, unquote. They approved of the Associated Press's decision to remove, quote, illegal immigrant, unquote, from their style guide. They frequently and enthusiastically expressed their support for the passage of Obamacare. 2007, when the idea of a $10,000 fine instead of deportation for illegal immigrants was floated in Washington, D.C., CPAC's Executive Director, Chawan Kim, gave the following statement. People who are in the country illegally tend to be among the poorest clients at the Center for Pan-Asian Community Services, said Chawan Kim, executive director of the Doraville nonprofit. So she doubts many could pay a fine beyond a couple $1,000s. Most of the undocumented, they are really underpaid, she said. In a way, they've already paid society. Another group, number 4, Puerto Rican Cultural Center. The first thing that appears on the website as of last week is a statement from the organization Centro Sin Fronteras. Centro Sin Fronteras is involved in the struggle to stop deportations and having a moratorium. We march and fight for the rights of immigrants. We march to stop the deportations and separations of our families. We're asking Obama to stop the deportations now, but instead, while the Senate is debating to pass an immigration reform, they're deporting and separating even more families than before. 2010, PRCC's executive director, Jose E. Lopez, was awarded the prestigious 2010 Health Award for the Health and Medicine Policy Research Group. The Health and Medicine Research Policy Group is an independent policy center promoting social justice and health care equality for the past 29 years in, just feel like there ought to be a drum roll, but in Chicago. Now, it's important to understand, you know, we welcome immigration. We need immigration in this country. It is fresh water flowing into this country, but it's got to be pursuant to the rule of law. It's got to be legal. And even 60+% of Hispanic adults agree we need to secure the border before we do anything else in the way of reform. And it's also worth noting that if a group like this had their way, we would never be able to deport terrorists. Like we had some that overstayed their visa, should have been deported. This group would be against that, which means they would be allowed to stay in the country and carry out the 9/11 attacks, which they did. Some of us have been pushing that the law be followed, and if people overstay their visa, then legal action be taken and people be deported, properly followed up. This administration and even the prior administration had not been doing that, nor the Clinton administration. But it's something that needs to be done if we're going to be a nation of laws. Yet these are the very people that are out there assisting people with their healthcare.org filings, getting their personal information, personal voter information. Gee, wouldn't it be nice if some of the groups that the IRS, after it was weaponized and began targeting, wouldn't it be nice if conservative groups were allowed to register people for healthcare.org and gather all of this personal information? And I'm being facetious, Mr. Speaker, because under the law, to be a navigator or a sister, you're supposed to be unbiased. Unbiased. And there's nothing but bias that we're seeing so far. Number 6, World Relief. Let's see, 5, Hispanic Liaison of Chatham County, group operators of Victims Assistance Program. That's great. But which helps crime victims concerned about pursuing justice due to their illegal status. Oh, we're back to that. Our Bilingual Victims Assistance Program began in 1997 with funding from the North Carolina Governor's Crime Commission. This program has been successful due to the trust we have developed with the Latino population and our collaborative relationship with community agencies. Several factors limit Latinos' access to law enforcement, emergency services, including fear of the unknown, fear of documentation checks, and lack of awareness that victims do not have to pay for an attorney. Number 6, World Relief Chicago. This organization's position on illegal immigration appears clear. They are currently assisting, quote, children of illegal immigrants in delaying their deportation through the DACA program. Their Twitter account links to an article titled Undocumented Migrants in U.S. Gaining Improved Access to Higher Education. Number 7, Alliance of Filipinos for Immigrant Rights and Empowerment. from their site's Civic Reflection page. This quote, a recently formed Chicago advocacy group for immigrant rights, the Alliance for Filipinos for Immigrant Rights and Empowerment, supports comprehensive immigration reform and more just treatment of undocumented immigrants. Since late last year, AFIRE has been using conversation about readings by Pablo Neruda, Franz Kafka, Tony Cade Bambara, and others to develop its organizational structure and mission. So it's interesting, we've got so many groups, and they're trying to help people who are illegally in the country, and yet they're helping people illegally in the country, and Demos is a part of this, and their stated goal is to get 68 million new voters registered. Well, this goes on and on, Mr. Speaker. We've got 40 organizations like Planned Parenthood. They're in here registering voters, apparently part of the Navigator's Assistant. I guess they're helping with Demos. Well, we need to know about these things. A lot of politically active Arab American Action Network, Arab American Family Services, Campaign for Better Health Care, CFL Workers Assistance Committee, Southern United Neighborhoods, just on and on. Inaffordable Housing, Inc., Chapman LLC, Family Health Care Foundation, CanAid, Inc., Too Hurt to Cry, Cutting Edge Health Options, Homebound Services, NWE Beginning Medical Services, Village Communicator, Metro East Area Communities for Empowerment. We got a bunch of folks that are supposed to be assisting and navigating for people that aren't able to get through the healthcare.org, and they have political motivation. They're registering. Their goal is to register 68 million new voters. No wonder this website's failing. If that's the case, that it was being used for political purposes, what a disaster. People scared about their health care, and these people just want to further their own political interest. Mr. Speaker, it's time we worried about Americans and against fraudulent voting and got America back on track to survive the years to come and flourish. With that, I yield back.
The gentleman yields back. The chair lays before the House a communication.
The Honorable the Speaker, House of Representatives. Sir, this is to notify you formally, pursuant to Rule 8 of the Rules of the House of Representatives, that I have been served with a subpoena issued by the United States District Court for the Eastern District of Michigan for testimony in a criminal case. After consultation with the Office of the General Counsel, I have determined that compliance with the subpoena is consistent with the precedents and privileges of the House. Sincerely, Karen Chernow.
The chair lays before the House a message.
To the Congress of the United States, Section 202D of the National Emergencies Act, 50 U.S.C. 1622D, provides for the automatic termination of a national emergency unless, within the 90-day period prior to the anniversary date of its declaration, the President publishes in the Federal Register and transmits to the Congress a notice stating that the emergency is to continue in effect beyond the anniversary date. In accordance with this provision, I have sent to the Federal Register for publication the enclosed notice stating that the Sudan emergency is to continue in effect beyond November 3, 2013. The crisis constituted by the actions and policies of the government of Sudan that led to the declaration of a national emergency in Executive Order 13067 of November 3, 1997, and the expansion of that emergency in Executive Order 13400 of April 26, 2006, and with respect to which additional steps were taken in Executive Order 13412 of October 13, 2006, has not been resolved. These actions and policies are hostile to U.S. interests and continue to pose an unusual and extraordinary threat to the national security and foreign policy of the United States. Therefore, I have determined that it is necessary to continue the national emergency declared with respect to Sudan and maintain and enforce the sanctions against Sudan to respond to this threat. Signed, Barack Obama, the White House, October 30th, 2013.
The message will be referred to the Committee on Foreign Affairs and ordered printed. For what purpose does the gentleman from Texas seek recognition?
I ask unanimous consent that when the House adjourns today on a motion offered pursuant to this order, it adjourn to meet at 10 a.m. on Friday, November 1st, 2013, unless it is sooner has received a message from the Senate transmitting its concurrence in House Concurrent Resolution 62, in which case the House shall stand adjourned pursuant to that concurrent resolution.
Without objection.
Pursuant to the order of the House today, Mr. Speaker, I move that the House do now hereby adjourn.
The question is on the motion to adjourn. Those in favor say aye. Those opposed, no. The ayes have it. The motion is agreed to. Accordingly, pursuant to the previous order of the House of today, the House stands adjourned until 10 a.m. on Friday, November 1st, 2013, unless it sooner has received a message from the Senate transmitting its adoption of House Concurrent Resolution 62, in which the House shall stand adjourned pursuant to the concurrent resolution.
The House is wrapping up work for the week. Members are off next week for a district work period. Lawmakers this afternoon voted and passed several measures, including one that would allow banks to expand the use of a type of financial derivative known as swaps. The House also approved a resolution disapproving of the debt limit increase passed by Congress on October 16th as part of the deal to end the government shutdown. All but 3 votes in support come from Republicans. The resolution has little chance of halting the increase since the Senate rejected the similar measure yesterday. As always, you can watch the House live here on C-SPAN when members return on Tuesday, November 12th. Health and Human Services Secretary